This is Beyond the Stethoscope, a podcast that brings you inside the conversation shaping healthcare across Pennsylvania, Delaware, and Maryland. I'm Colleen Winecombe. Today we're talking about something more and more families are navigating: pregnancy later in life. Across the country, more women are choosing to have children in their mid-30s and beyond, often balancing careers, finances, and life goals along the way. But with that shift comes a lot of questions about fertility, about risk, and about what that really means for a healthy pregnancy. Joining us is Dr. Hartaj Powell, Medical Director of Obstetrics and Gynecology at Holy Cross Health. Dr. Powell, thank you so much for being here.
Thank you for having me.
So let's start with the big picture. Essentially, what's driving this? We're seeing more and more women delay motherhood than ever before. From your perspective, what's the cause?
Yeah, I'm really excited about our conversation today. I think especially about the topic, it's very personally relevant to me as a woman who had a pregnancy at age 35 or older.
Yeah.
It's a trend that's not only here in the United States, but globally as well. Here in the United States, 19% of all pregnancies and 11% of first-time pregnancies are in women aged 35 years or older.
Wow.
So it's definitely more common than not. And there isn't just one driver of that. I think you touched on a lot in your opening. There are social, economic, financial drivers for this that really comes down to life choices and opportunity. Women are spending more time in school, they're building their careers, and they really have the opportunity with advancements in reproductive technologies, as well as with the mirage of really highly effective birth control, to take advantage of deciding how and when they want to start a family.
So interesting to put a number on it, because you see it in real life and your experiences, but that statistic is very dramatic. So thank you for sharing that. Language comes up pretty quickly when talking about this. For a long time, the term geriatric pregnancy was used, but understandably that didn't sit well with a lot of people. Today, we're hearing more advanced maternal age. Can you talk about that shift?
Yes. So actually, it's not a term that I was familiar with until more recently.
Okay.
When I was in training and during my pregnancy, I was referred to as advanced maternal age. Okay. So that's what I'm used to. And it's actually a friend of mine who was in her early 40s on her second pregnancy. She called me after an appointment and jokingly said I was referred to as a geriatric pregnancy. Gosh. And I was kind of shocked and said something to her like, that's kind of mean.
Yeah.
As you can guess, geriatric pregnancy was a term used to refer to a woman who was having pregnancy at the age of 35 or older. And geriatric means elderly and it really refers to someone who is 60 years of age or older. So it's not even accurate to describe a woman who's 35 years old as a geriatric pregnancy. And so really that shift has been towards using the term advanced maternal age, and it's more respectful, it's more accurate, and it destigmatizes having a pregnancy at the age of 35 or older.
Yeah, that's very true. It's just conjures a different connotation, I think, than what the intention would probably be.
Yes.
Fertility is often when this topic becomes very real for people, I would think. What's happening in the body as we age that makes it harder to get pregnant?
Yeah, so it's back to biology, high school biology. So it's a simple way to look at it or think about it is that a woman is born with all of the eggs she's going to have in her lifetime. Okay. And as she ages, the number and the quality of those eggs decreases. So what does that mean? It means that her ability to achieve pregnancy is a little bit more challenging as she gets older, but also increases the risk of genetic or chromosomal abnormalities.
There's also this perception that modern medicine can solve a lot of these challenges. There are IVF, there's egg freezing. How much has that changed the landscape? And when you're talking with patients, how do you balance that sense of possibility with the biological realities?
So yeah, it's definitely changed the landscape. With in vitro fertilization, egg freezing, it gives individuals more options and flexibility. But the thing to remember is that technology isn't going to override biology. So age, and especially the age of the eggs, still is a significant impact on outcomes and risk. And when I talk to patients, it's about understanding the limits of technology and optimizing by planning early.
How does care management change for someone who's having a baby post 30 or beyond?
Yeah. So really from the patient's perspective, they're probably not going to notice a change. The basic pregnancy care looks the same.
Okay.
From an obstetrician standpoint or from your women's health provider standpoint, it means that we might order additional lab work or more frequent visits or additional sonograms because we know that you're at higher risk of certain things like gestational diabetes, hypertensive disorders of pregnancy like preeclampsia, a stillbirth pregnancy, or a premature delivery or preterm delivery, or having a baby that's low birth weight, which means that the baby might need a neonatal ICU admission. And in terms of the labor, labor dystocia or abnormal progression of labor, which puts you at a higher risk of a C-section and postpartum hemorrhage. So what that looks like from the provider side is additional lab work, ultrasounds, additional visits.
Okay.
But most women, the key thing to remember is that most women will still have a normal, healthy pregnancy and outcome for the baby.
When people hear high risk, it can understandably feel scary. How do you have conversations about risk in a way that's honest but still is reassuring?
Yeah, so I usually try to reframe it, right? So high risk doesn't mean that something bad is going to happen. It just changes the odds.
Yeah.
So really focusing on optimizing your health. It will look like more check-ins, more visits potentially, more support, more information.
Let's talk about the positives for a minute, because there isn't only risk, there are benefits too. From your experience as both a doctor and a mother, what are some of the positives to having a baby later in life? Is emotional, financial, even in terms of how prepared you may feel?
Yeah, I think that's such an important question. We're talking about all the risks, but there's really some great benefits of waiting later in life to start a family. And I know for me personally, I felt more ready, both professionally and financially. I was able to pay off loans.
Sure.
I actually didn't have a partner in my 20s. So in my 30s, I had a great partner, and we were both able to sort of enjoy adulting before having a baby.
Yeah.
Because in our training, we work really hard, long hours, and just didn't feel ready and confident. And I think those themes is what you see for many individuals who wait later in life. They tend to be more confident. They have had a lived experience, and potentially in a better financial situation. They were intentional with their pregnancy. So I tend to find that they're more engaged, they ask more questions, and feel more prepared.
Yeah, that's a really important point, that they're more intentional with their pregnancy more often, probably in that age group. So age is just one part of the story, though.
Yes.
Is that right? What other factors can influence pregnancy risk just as much or even more than age?
Yeah, you're absolutely right. Age is just one piece of the puzzle. So there are a couple of other things that play a role in the outcomes for pregnancy. Most importantly, your overall health and access to care are huge determinants of outcomes. And starting prenatal care early and optimizing your health, checking in with your primary care physician. We know as we age, we're more likely to have a chronic medical condition like hypertension or diabetes, and lifestyle is another important factor. Your stress levels, nutrition, those basic things.
So we're also hearing more about personalized prenatal care. What does that actually look like in practice, especially for someone who may be considered higher risk?
So I think that's really patient-centered care, and it can look a few different ways. It could be more check-ins, more lab work, specialty care, referrals for specialists, or a team-based approach. And it's really a way to bridge sort of the gaps in traditional medical care where we often feel rushed and it feels inadequate. And not just for the patients, for the obstetricians as well. And that team-based approach can include doulas, midwives, group prenatal care, even specialized or concierge OB services.
Okay. So technology has also come a long way when we talk about some of the advances like IVF and egg freezing. So whether it's genetic screening or more advanced imaging, how is that changing the way you care for patients today? And does having access to that kind of information help patients feel more confident going into pregnancy?
So I think in terms of changing how we care, it's more about the counseling that goes into it. Because you're right, we have had significant advancements, and also just the reliability of the testing has become so accurate. We're able to detect even rare conditions. And so having access to that technology, having access to those tests earlier on in the pregnancy can actually decrease anxiety. I know for me, that was the case, being an obstetrician and advanced maternal age. Having all of that genetic testing done early on in the pregnancy and having that 20-week ultrasound and having all of that come back as normal was really reassuring. And it felt like a weight being lifted, and I could finally sit back and enjoy the pregnancy. There's a flip side to that, though, too, right? So with the advancements and sort of being able to detect even rare things, we have to be cautious. Because if we don't know what the implications are of that information, of that testing, it could actually increase anxiety. So really, it's about genetic counseling. So being able to understand what the results mean and not just what the results say.
Is there another take-home message, one message that you want to make sure people take away from this?
Yeah, I think it'll piggyback on that. I think the key message is that age matters, but it's not going to define your outcome. Definitely is some risk associated with later in life, but most people will have a healthy, normal pregnancy.
Dr. Powell, thank you very much for your time today and for helping to bring clarity and reassurance to such an important topic. I know this will help a lot of people, and I greatly appreciate you being here.
Thank you for having me.
Thanks for joining us on Beyond the Stethoscope. Don't forget to hit the thumbs up and subscribe to get new episodes.